843 TV, where the Lowcountry comes to speak.
.843 TV,
where communities come to speak.
We are here today to open a discussion. Welcome 2024, Pam Toney, BJVIM, Bluffton, Jasper County Volunteers in Medicine. Thank you for hosting this panel discussion and roundtable today. Really excited to have Ann Caywood from Legal Volunteers. It's great to see you.
Thank you.
Bluffton Self-Help. Courtney Hampson, thank you so much. And this is really your brainchild, and we're excited to share a little bit about the reason we're opening this discussion today.
Well, we're excited to have everyone here. I'm not quite sure it's my brainchild. I think it's all these lovely ladies that have been helping us.
Collaborative women,
It's collaborative,
right?
That's exactly right. But we're finding now that free clinics are so terribly important in all of our communities throughout, not only throughout the Lowcountry or South Carolina, but throughout the country.
And you've got data to support all of that.
I do, and we're excited to share that. And that's one of the reasons why I wanted to bring everyone together, that when we think about health, we think about doctors and nurses and shots and surgery and things like that, but there's so much more to someone's mental health, to someone's health, not only mental health, but also well-being. And so these ladies are here today. We have formed a collaborative. We have signed memorandums of understanding, so this is a signed deal that we're going to work together. We have been working together for the last number of years, but this is more of a strong commitment to be able to work together.
May we talk, and may I ask each of you a little bit about how you all play together, and just so people know the way that this is going to work, we're going to have 3 different segments, and we're going to talk about the collaborative, then we're going to talk a little bit about the legal issues, we're going to talk about Bluffton self-help, and then we'll pull it back all together.
Right.
So collaboratively, how do you all work, Courtney?
Well, I think one of the most important things is, one of the hardest barriers for folks to overcome is the process and asking for help and the paperwork. So one of the first things Pam and I did was look at our intake forms and agree that we would share one. So if someone comes to Volunteers in Medicine and needs to come to Bluffton Self-Help, we take VIM's form, and vice versa. So we agreed on what the important information was so that somebody doesn't have to fill out a form twice, and that alone helps smooth the path.
Can you give me an example of what that might look like? Like, what would be a coordinated or a question that would be now on one form that typically wouldn't have been?
It was more probably about eliminating some so that we asked questions that may not be relevant at Volunteers in Medicine and vice versa. So we kind of narrowed to 15, we need your name, we need your address, your age, key kind of demographic info, because we know that once we start talking with someone and having a conversation, we're going to learn the other pieces. So for us, it was about, one, making life easier for our teams to work together, but really for our neighbors and the patients at VIM to make their life easier.
And one of the things you both said is it's not simply about the patient either, because patients are part of a system, and that system is a family. And you said that it really tracks for a whole family also. And how about you, Ann? What works? How do you work with this?
Yeah, so it was exciting when Pam and I joined forces and talked about the fact that we serve the same clients. So it's the same folks who may or may not have equal access to justice. They're getting care, but it might not be treating the whole person. So that's why we decided to collaborate and come together, hire a medical legal partnership attorney. Hannah Kidd, who is going to be in clinic at least one day a week, and do some education for staff and volunteers about what's a legal issue, what needs are there that we can meet, or at least find those resources for folks to get equal access to justice.
And so people may come to you first, they may come to you first, they may come here first, and that's the collaborative nature. So it goes in all directions. I mean, that's really powerful stuff when you think about it. 2024 begins this collaboration, or actually it started a little bit before that?
Well, I think like any program, it takes a while to get started. We had hoped that right away we'd be able to have all these people that would be banging on our doors, and we'd be swapping these applications, and that hasn't quite been the way we've started it, but we certainly have started it. And
Well,
so
hopefully-
we're hoping to expand it in 2024.
Exactly, and hopefully opening these kinds of discussions where maybe people understand more what each of the organizations do and how they can work together will really help and make an impact. We're going to take a quick break, and we'll come right back. And would you share a little bit when we come back about what
Absolutely.
you actually do? Stay with us.